హాయ్ అందరికీ నమస్కారం. నా పేరు డాక్టర్ శశికాంత్. నేను ఒక సీనియర్ కన్సల్టెంట్ ప్లాస్టిక్ సర్జన్, కాస్మెటిక్, క్రేనియోఫేషియల్ సర్జన్. Liposuction. There are a lot of misconceptions about liposuction. So should we do a liposuction or is it safe? Yeah, if you ask me, it's absolutely safe. Liposuction is a principle where we suck out the excess fat deposits in the different parts of the body. It can be tummy, or it can be arms, or it can be breast, or it can be male breast, it can be back. So there are different areas beneath the skin where fat gets deposited. So that is where liposuction comes into play, because liposuction does not cover the fat which is deeper in the body, like abdominal inside, the fat which is inside the abdomen, like omental fat. All these things we cannot do it by liposuction. So liposuction is the process or a procedure where we remove the fat beneath the skin which is deposited in excess. So that is the principle of liposuction. We suck out the fat. So how do we suck out the fat? So we inject and infiltrate which consists of a local anesthetic as well as a hemostatic in the sense which decreases the blood supply to that particular area, so that when we do liposuction, bleeding will be minimal or minimized. Bleeding will be minimized. So is it safe? Yes, it's absolutely safe, because the process which we use for liposuction presently is we infiltrate a good amount of hemostatic infiltrate. So what happens is it narrows or constricts the blood supply or blood vessels which within the fat, and it makes, and the fluid which we inject, it loosens the fat. So once the fat gets loosened, and as well as the blood supply or blood vessels which supply the fat, it becomes narrow and decrease the blood supply because of the hemostatic drug that which we inject. So the actual bleeding complications and other described complications, which are very extremely rare, they will not occur. So in that way we decrease the incidence of so-called complications by doing these things. So how safe it is? Yes, it's absolutely safe. So what do you do to make it absolutely safe? Give a good infiltrate injection, inject good amount of infiltrate, and have a complete understanding of the anatomy of the area where we are doing our liposuction. For example, you do a tummy liposuction of the abdomen. So you should keep on feeling the liposuction cannulas with your hand all through the course of the movement of the cannula, so that you ensure that the cannula is in place and doing its job. So in that way we ensure that the cannula is moving in a proper direction and proper planes. Similarly, good infiltrate decreases the post-operative pain and everything. So in that way we make sure that the liposuction is absolutely safe. And having a complete understanding of the anatomy of the area where liposuction is done is the primary prerogative, I would say, of the treating doctor, so that side effects are very less, or in fact none.